If I asked you what the most common finding on rectal exam by a urologist checking a male for an elevated PSA, what would you say? Well, the most common finding is a normal prostate exam. And the reason that is because now most exams are done because the family physician has referred the patient to the urologist because of an elevated PSA, and then the urologist in turn does the exam, which is most commonly normal, and then does the biopsy. But the point of today's discussion is about a prostate nodule, and what is the significance of an abnormal rectal exam, a prostate nodule, and how does that aid the person trying to make a decision about his prostate cancer? Well, first of all, if there's a prostate nodule or a palpable area on the gland, that's usually a disease that has been found a little later than you prefer. It's not the end of the world, but it's just a little more aggressive usually than if the exam is normal. Second of all, the most important thing is, let's say a guy is inclined to do nothing or do surveillance, or let's say he's inclined to do some sort of therapy that he thinks is a blend between what is aggressive but has the least side effects. Well, in my mind, having a prostate nodule would make you tend to think more aggressively. And now that you've listened to this video cast, if you are that person with a nodule and you're considering your options, this is something you'd want to discuss with either your urologist or the radiation therapist. This, in combination with who you are, the other specifics of your biopsy, rectal exam, PSA, and the who are you factors, in other words, your lifestyle, your work, your family, all of this becomes part of a larger plan of set of circumstances that will help you make a decision that will be right for you. And finally, obviously, if your neighbor or a church member or your uncle did us a certain treatment and his exam was normal, and you have a prostate nodule, then your decision-making process will be different than his, and that's something you need to be aware of. Well, this is John McHugh. It's another caveat regarding prostate cancer decision-making, and I hope it's been helpful to you. What?